Hey, I'm your host, Dr. Desiree Cassell. I'm an orthopedic and pelvic floor physical therapist specializing in women's health, aka pelvic floor. I'm a wife, mom of 3, foodie, lover of all things movement and nature, and I'm super passionate about educating, empowering, and supporting other women like you to find and maintain balance throughout all aspects of their lives, without pain, pressure, or peeing their pants. And this is the Balanced Momtality Podcast, where we will talk about all things pelvic floor, your core, and optimizing your pregnancy, birth, and postpartum recovery, providing you with the knowledge and tools so that you can feel like the strong, playful, and happy mom that you and your family deserve. Now let's get you out of those pads and back to loving movement. Fill up your water, pop in those AirPods, roll out your mat, and let's connect. Before we start today's episode, just a quick disclaimer that anything mentioned in this podcast is not meant to treat or diagnose any medical conditions. If you have any questions or concerns about your healthcare needs, please seek the care of your medical provider. This is also a safe space where we will be talking about very sensitive but important topics, such as issues with peeing and pooping, relationships, and even sex. So if you have littles around, probably a good idea to pop those AirPods in. But otherwise, I hope you enjoy today's episode. Hey friends, it's your host, Dr. Des, and I'm so glad to have you joining me again this week for another episode on the podcast. Last week was our 200th episode, you guys, which is a huge milestone for me. So I would just be so grateful if you helped me celebrate by leaving me a podcast review. These really help my podcast continue to grow and be visible for all the women looking for the answers that you guys have found in this show. So if you found it helpful, please leave me a review. It's at the bottom of my podcast page on whatever listening device or server you're listening on. And also, I am offering you $20 off some one-on-one coaching. So whether you're looking for virtual or in-person physical therapy or women's health and pelvic floor coaching, we are now offering $20 off as long as you're mentioning the podcast when you're booking that visit. The information is in the show notes below. This is only going to be running for a short period of time, and I want you guys to jump on this. So until the end of July, I am offering this $20 off, and it's July of 2026 if you're listening to this sometime in the future and you missed it. But otherwise, I hope you caught it not only for the 200th episode, but we did start to dive into a complex issue, which is hypermobility, and how do we target that? Because a lot of people really want to stretch when they or feel tight, but a lot of times when we're hypermobile, our joints are holding tighter because our bones and our joints are moving too much. So in reality, a lot of strength and stability is really what we need, but there's a lot more beyond that. And I lay that out in that episode. I lay in the order of, should we be stretching? If so, when? Should we be doing soft tissue release work? If so, when? And all of that good stuff. So go check it out, especially because that episode is playing into this week's episode where we are diving deeper into hypermobility, but we're not just talking hypermobility today. Today, we're getting a little bit more close and personal with an issue that I have been dealing with for the last couple years, and I've talked about a couple times on the podcast before. So if you didn't know, I do have pelvic venous disorder, aka PeVD, aka pelvic congestion syndrome. I do have a couple episodes on that in the podcast already, so I'm not going to do a huge deep dive into what that is specifically today, while we will touch on it. But today's episode isn't even just about PVD. It's more about this overlap I've been starting to research and see a lot, not only in myself, but in other women and patients that I've been working with. Because yes, obviously I'm human. My body is not perfect in perfect health. I mean, the reason I started getting into women's health is because I was peeing my pants myself, right? So we are trying to heal our bodies just like you guys out there. And of course, yes, leave it to the pelvic floor PT to get a pelvic floor problem she can't solve on her own. Because yes, PVD is a condition that I treat regularly, but it's a condition that also really needs to have a holistic healthcare team, because it's not just something that my skills can treat. I needed to actually get some procedures done to help with this venous problem in order for my body and my skills to be able to actually show that benefit and take my symptoms away. So today I did want to touch on this overlap that happens not only with PeVD and not only with hypermobility, but also with these other conditions called MCAS and POTS. So we're going to dive into that more in today's episode. So if you do have it, or if you have ever felt like your symptoms are all over the place, right? Like you have dizziness with standing, you also have some pelvic pain, you have some bladder issues, digestion symptoms maybe, you feel fatigued all the time and tired. You also have like heaviness and pressure in your pelvic girdle or your lower abdomen or your legs, or anxiety-like symptoms, and nobody can explain how they're all connected, then this episode is for you. Because what if these seemingly unrelated symptoms were actually pieces of the same puzzle? And this is what I'm starting to see in my own body, and again also in other women that I have been working with now, knowing this information, because that's really the cool part about, right, if there is any cool part about getting your own issues, is especially as a provider that should be treating them, is that we now are forced to learn more about them. So now I feel so much more equipped to handle these symptoms and these conditions like PeVD, and even things that don't seem to be as obvious that they might need PT, like POTS and MCAS. But these are also things, and even especially hypermobility, these are conditions that do need PT, and especially pelvic PT support. So we're going to get more into that. But more women are learning about POTS. There's more awareness about MCAS. I understand, like, just for myself, as I've been searching these things online, my algorithm with social media really is a lot of these things. And of course, I am seeing it more myself. But in general, these are conditions that are starting to get more awareness, and which I think is great, because otherwise it just becomes these blanket conditions that we're hearing from our providers that no one really has answers for, and we're getting frustrated because we're getting sent to just one person and they don't have all the answers, because this is all connected and they are affecting different systems in our body. So you need that holistic approach from all these different providers on your healthcare team to make sure you're getting that big, highest quality of care. But let's dive in first to what these individual issues and conditions are, and then we'll talk about more how they're related, how this affects your pelvic floor, because it seems from the outside in that these aren't all related, right? Like, I know for me, I had some ovarian site pain. I thought it was a cyst, okay? And I didn't even have the typical symptoms of PeVD yet. So I think that because I have the body awareness I did catch this earlier on. But as I was starting to get closer to my procedure date, my symptoms got a lot worse, and they did start to become more of the typical PeVD symptoms, which are heaviness and more pelvic floor pressure and pain with sitting too long, with standing too long, with exercise, with sex, right? Anything that's going to either increase blood flow or pool and cause stagnant blood flow. So this is where there's that nice balance of making sure you're staying moving and supporting your vascular system so that the blood flow doesn't become too stagnant, but also not overexerting yourself, especially when we're in flares in spaces where now we are getting too much blood flow that's causing a backup in that system, because then we do get symptoms like a sharp pain in that ovarian site. It could also show up as constipation, hemorrhoids, and PVD is varicose veins. So if we just dive into that right away, like what is PVD? It is just pelvic congestion or a backup of blood flow in the venous system. So it used to be called pelvic congestion syndrome, but now it's called PVD or pelvic venous disorder, because that's really what it is. It's a venous disorder. So it is varicose veins in your pelvis. That's as simple as it gets. It's varicose veins in your pelvis where those veins got so backed up, maybe during pregnancy, or like me, I actually had a physical compression of my vein internally from the artery just based on how my anatomy grew when I developed, right? And so this caused those blood vessels, probably especially during pregnancy, and especially because I'm hypermobile. So you can start to see this connection as we talk about these conditions, because if your vessels, like your veins, are extra stretchy, right? They have hypermobility, they have more stretch capacity in that tissue, then it's going to stretch more. And this doesn't mean it has the recoil capacity with that, right? So it's stretching more and it's not recoiling and giving the pressure it needs to keep that same flow of volume moving up the system. So this is where we get that bulge, that pressure bulges out the vein and causing varicosities that sometimes can be very painful. And sometimes they're not, which is why it can also be confusing for a lot of people, because their providers might even say, like I've been told, oh, veins don't cause pain, just it's a red herring, don't even worry about it. In fact, that's what I was taught in PT school, because we are taught not to worry about the bigger picture of the veins having a dysfunction, because we can get a lot of symptoms to calm down regardless of that vein. This is true, but also false, because yes, we can get a lot of symptoms to calm down, but if you ignore that vein issue, right, that swollen enlarged vein, or maybe it's a pinched vein, whatever it is, if you ignore that, then over time that traffic jam moves down the system, and this is where you start to see varicosities in the legs and feet and ankles. So yes, we need to look at everything. And it could be heaviness, it could be aching, it could be especially symptoms that are worse at the end of the day. That was a key thing for me. I noticed that by doing the dishes in the evening after dinner, I was super uncomfortable, and I was always leaning on the counter to try and offlate my pelvic girdle. And then as soon as I laid down or elevated my pelvis, the pain went away. And so after I started to learn more about what was truly happening, it all made sense, right? Like my body didn't have the support in the tissues to keep that blood flow pumping, so it started to stretch out and cause all of these uncomfortable symptoms. But I've even had PeVD in patients cause vulvar burning and tingling. I've had it cause just constipation or back pain. I've had it not cause any symptoms at all, but they found it just routinely on an ultrasound, and then they realized, oh, actually, I have had some GI symptoms, and I thought I just had cyclical ovulation pain, and these things that we just ignore or think are normal. So this is commonly overlooked, and it is a pretty common diagnosis. So if you do have any of these symptoms that I mentioned with PeVD, definitely reach out. The first step for this is getting an ultrasound, and then they will refer you for a CT scan, and we'll get into more of like who you should be seeing for this. But with that, let's also dive into what is POTS, okay? So POTS is Postural Orthostatic Tachycardia Syndrome. This is essentially when your autonomic nervous system, which again, this is kind of the common thread through these conditions, is this dysautonomia, right? This disruption in our autonomic nervous system, because your heart is part of that autonomic nervous system, and it should be getting feedback in your body based on your position, based on the volume of blood, based on the receptors around your arteries and in your body, and yada yada. All this input is coming to adjust the heart rate, to keep enough blood and oxygen pumping through your cells and your tissues to keep everything healthy and keep you not feeling, fatigued and brain fog, or worse, passing out and dying, right? And so with this, a lot of symptoms with this is when like you're laying down, and it can be very commonly misconfused as just orthostatic hypotension, which is the reality of being laying down or sitting, and then you get up too quick, right? That's happened to a lot of us. You get up too quick, you're a little lightheaded, you're dizzy, even sometimes maybe your vision might kind of like get foggier, fuzzier, tunnel a little bit. But then after you, breathe a little bit, drink some water, stand there a little bit, you're good to go. So orthostatic hypotension has very similar symptoms because it's a similar thing. There's a disruption in how much blood flow is getting up. Not enough blood is getting to your head, essentially. But so we are getting symptoms of dizziness, but this also comes with a racing heart, because that heart is trying to pump that blood flow up to keep enough blood up there, but we're just not getting it. So the heart's not getting that signal that there's enough, so we're getting that tachycardia. But because of this, we might not actually be getting enough oxygen. We are going to get some fatigue. We're going to get some exercise intolerance. We're going to get some brain fog. And this can seem like it's just some common thing like, oh yeah, well, it's around my time of the month, right? I'm tired right now. I'm extra tired and I'm just haven't been drinking enough water, so I'm dizzy. And yes, obviously drinking enough water can really cause some flares with these syndromes, but it's not the only thing going on, because there's also MCAS. So what is MCAS? And I do just want to clarify, like, you can have just one of these conditions in terms of syndromes, because that's really, or symptoms, because that's really what all these are. These are just like syndromes, which are just clusters of symptoms. And I'm getting these S words confused today. My brain is also a little foggy today. So with that being said, right, a syndrome is a collection of symptoms. So that's what your provider's doing. They're seeing all these symptoms. Your labs, they're going to start doing some labs based on these symptoms you have. But you start to get diagnosed with these conditions once they see a similar common pattern cluster of symptoms, okay? So if you do have those cluster of symptoms, they're going to say you have this syndrome. So some people might just have one syndrome. Some people might have multiple of these. So as you hear these different syndromes and you do hear, oh, but I do have that in that syndrome, but I mostly have these other symptoms within this syndrome she mentioned, you might have some of this overlap that's going on and why we're talking about it today. Because MCAS. So MCAS is Mast Cell Activation Syndrome. And this is when the histamine system in your body, which contains these mast cells, right? These mast cells are part of this histamine system in your body to protect you. However, MCAS is when it's overactive, right? We're getting way too big of a histamine response in the body, and it's throwing off all the things because yes, it, like when you get allergies, right? And we can think of it as very obvious, like, oh, I'm sneezing and coughing and I've got a rash and allergies, but it's a much deeper impact in the body than that, because the histamine process, the histamine system in your body is impacting so many things: your digestion, your hormones, your skin, your inflammation, right? Like it's affecting a lot. And so because of that, yes, we can see worse allergies with MCAS. We can see more sensitivity in general, whether it's to food, to clothing, to smells, right? You're just more sensitive. Your system is hyperactive and giving you these bigger responses like rashes or maybe more sneezing, or maybe you're getting actual hives. I know with my flares, I actually get hives on my body sometimes from exercise or when my body's overheated and it's too sensitive around these flare spaces. So any skin reaction, also digestive symptoms, but it is pro-inflammatory. So you're just seeing that inflammation all over the body show up in different ways. And this is why it can affect different and many times multiple body systems, and why it takes multiple providers and specialists to really give you the big picture of what's going on, which is a bummer. Obviously, like it'd be nice to just see one person and have them fix all your problems. But at the same time, we need to get out of this thinking, right? Like, and this could be its own podcast episode. We need to get out of this thinking that you're going to see someone, they're going to know your answer to your problem right away. They're going to give you the solution. Like, this is what we call the quick fix. And in this convenience culture, we want to just, give me the answer, give me the quick fix, give me what it is. But a lot of times in almost every situation, it's way bigger than one problem. It's way bigger than one moment in your life. It's way bigger than one lab value. It's way bigger than one habit. It's way bigger than one prescription. It's way bigger than, one procedure. There's so many things going on, even if it's just stress, even if it's just constipation, even if it's just I have low estrogen, even if it, right? Like there's so many things that start to cascade when one thing in the body goes off. And if you're just too blindsided and narrow-minded and thinking that one person is going to solve all of those problems, then you're not going to get the results you want. It takes a bigger team, and it's good to have that team on your side so that you have multiple viewpoints, multiple specialists giving you their insight, and then ultimately you get to decide, right, like where you want to go from there. But there is a huge connective tissue link. This is the big link that I was kind of preluding to with PeVD and hypermobility and MCAS, because
because when we have that hypermobility, the connective tissue is lax, right? There's more stretch. This changes that vessel integrity, which then does change how much organ support you have. So we can get more prolapse, we can get more varicosities and pelvic venous disorders because of this. We can get more joint arthritic changes and sprains and risk of injury because that connective tissue is more loosey-goosey. We can also get just overall, because of the change in the vessels, this gives different signals to the heart and the thyroid and the gut and the liver and all of these other parts of your body, which then can create these inflammatory responses in the nervous system, in the autonomic nervous system, because it's overall just dysfunctional. And this is the part that's so hard, because it is just, from a lot of areas, it can be overwhelming. But because my specialty is the pelvic floor, I want to give you some strategies for how the pelvic floor gets involved first, and then some strategies from my end that you can do to start supporting this connective tissue issue that is going to then impact all of these other conditions and syndromes. So with that, first, we're going to just talk real quick about how the pelvic floor can get involved, right? So you've already heard me say some of these symptoms. So pelvic heaviness, pelvic pressure. This could be because of prolapse. This could be because of PeVD. This could be because of constipation and gut issues, all stemming from the root cause that your connective tissue is dysfunctional and hypermobile. So that pelvic pain from the heaviness, because from the hypermobility, because again, with hypermobility, a lot of times the muscles especially are going to tighten and lock up to try and protect these joints that are moving too much, protect these pelvic organs that are moving too much, protect all of the heaviness and weight and inflammation and extra blood flow that's weighing down on the system. We can also get urgency and frequency because of that extra tensing in the body and the extra pressure and heaviness. We can get constipation, whether it's from the blood flow not going to the gut and slowing down motility, or from the tension and clenching in the pelvic floor closing up the actual rectal anal sphincter and causing that upward backup. We can also get painful intimacy and dyspareunia because we are getting tension and irritated nerves and more pressure and heaviness, maybe from varicosities and extra blood flow in that space. And this is why many times one of the big symptoms with PeVD is pain with intercourse, because you're just getting so much blood flow there. But we really want to just focus, because of this, you're noticing these symptoms are coming a lot from tension, right? It's this guarding, this protective tension, which then leads to compensation patterns. And so what we're going to bring over from that hypermobility episode is that we do need strengthening to make sure your pelvic floor isn't guarding and tight because of all of this hypermobility and not feeling safe and strong. So we do want to strengthen, and we want to do it safely though, because as we know, if we strengthen with tight tissue, we can make symptoms worse. And so this is why strengthening alone also isn't enough, especially with something like this where it's impacting multiple systems in the body. It's not just the pelvic floor, right? So this is why we do need to look at your nervous system regulation. This is why breath work, and I say this in every episode probably, is a huge key to calming down these symptoms, especially with that back of blood flow, because the breath work is working with that pelvic floor and diaphragm to create that piston motion, or what we also call the sump pump, to help push and move that blood flow through the system and through that core space so it doesn't get backed up. But also the breath work is calming the body. It's calming your nervous system. But even beyond breath work, the nervous system regulation is huge. Do something fun and joyful. Ground yourself outside in nature a little bit. Do some journaling. Do some meditation. Whatever you know helps calm your nervous system. We need to prioritize it when we have multiple issues like these cases do. And again, pressure management. So we're looking at that physical motion of the breath, the physical motion of your bracing, your engagement of your core. Are we bearing down with our core brace? Are we holding our breath? Are we physically doing things that can push too much pressure down? And these are things that I can see virtually through coaching. So if you're not local, don't worry, friend. I'm here for you worldwide. We can do virtual coaching. See what's going on with your pressure management system. See what's going on with your bracing. See what's going on with your breathing. Optimize these mechanics so that even while you're trying to figure out these other inner pieces, that we are tackling the hypermobility, because that's the root of all of these other issues. But also looking at pacing ourselves, right? So that's where I noticed, if I'm just on my feet too long throughout the day, I get heaviness. And sometimes it shows up sooner. Sometimes it shows up at different times of the month. And if I'm not pacing myself, it'll show up worse. So keeping an eye on how much time on your feet before you get symptoms, and then looking at actually elevating and unweighting your pelvic floor by physically tipping your butt up in the air, right? Whether this is puppy pose, whether this is putting a pillow under your butt and letting your legs go up the wall. We just want to get things elevated so that all of that blood flow, all of that pelvic weight and pelvic organs and intestines can just off weight and take some strain off of that space. But circulation is also obviously a problem, right? That hypermobility, it's a blood flow and this autonomic system, but that circulation doesn't just stop at the veins. It's also your arteries. It's also your lymph flow. So you have to make sure we're optimizing that as a whole body space and not just in your pelvis. And so looking at your exercise, keeping that blood flow moving, making sure you're not sitting too long at work. So pacing also looks at not just are we, moving too much and on our feet too much, but also are we just sitting too much? Because again, that's stagnant blood flow. That's going to make your circulation back up. But even aside from exercise, even things like vibration plates, compression garments, these can all really help with holding that system a little stronger, a little bit more supported, so the tissues can help that blood flow go up without extensing so much that they permanently are damaged and stretched out, and then you now need procedures to help correct that. We also need to look at our recovery, okay? So recovery is huge, because if we are pushing too much, we can cause blood flow to get kind of trapped and stagnant and cause pain and inflammation and varicosities and just cause huge symptom flares. You might get a POTS flare from it or a MCAS flare from it if you didn't recover well. So taking rest, not overdoing it, not just being a bum during that rest time either, but physically recovering your tissues, eating well, sleeping well, hydrating well. All of these things are important. I think I said sleep, hopefully. If not, I probably need more sleep. If you can tell, my brain's a little all over the place. It's also about to be my time of the month, so I'm blaming a lot of this on that because my brain is just extra foggy this week. With that, we are moving on. I know this is a lot and I have just been rambling, but I hope it has been helpful, because this has been a very frustrating and overwhelming experience for me, just navigating PeVD and then starting to notice some of these other, MCAS symptoms and even some POT symptoms, and starting to even notice some of these symptoms in my daughter, and really just being like, crap, I want to know all there is to know about this, because it can't just be me and my skills. This is a bigger issue. So we need to get that whole body approach, and we also need to have that holistic healthcare team approach. So again, what actually helps as far as a whole body approach? PT, obviously, right? We talked about some of the things we do for that. The nervous system support. This could be even some counseling beyond some of the other things we talked about. Gradual conditioning, hydrating, movement, breathing, strength. These are all super helpful. But beyond that, this holistic healthcare team, this is one of the biggest challenges for women with POTS, MCAS, hypermobility, and pelvic venous disorder, or maybe you're just having pelvic floor dysfunction and some symptoms there. And they do often affect multiple symptoms in the body. No single provider has all the answers, like I've said, and instead of searching for that one magic fix, many women benefit from that bigger team, building that team of providers who do understand the different pieces of your puzzle. So your PCP is a great person to have, obviously, because they are the person that are going to get all of this information and help you navigate referrals and all of that, so that they can help coordinate your care, order some testing, and help you navigate the specialists I'm going to deal out here in a minute. And ideally, this is someone who actually listens to you and validates your concerns and is willing to look beyond the isolated symptoms, because too many times I've had women, and even myself, go in with just some symptom and be written off with imaging. Maybe they even got imaging, but the tech wasn't looking for the right thing. wrong, and so they missed it, right? And so advocate for yourself. And if your PCP or any of your specialists aren't hearing you or aren't looking beyond just these one symptoms, then it's better to continue and get a second opinion. But the first one I would get on board is a cardiologist, especially someone familiar with POTS, because this is where we're looking more at that tachycardia, right? This autonomic cardiac issue. And so especially for the individuals who have dizziness, fainting, racing heart, maybe exercise intolerance, right? You can't handle exercise for very long or at high heat. Blood pressure changes, you're getting lightheaded and it's not coinciding with even just a postural change. A cardiologist or an autonomic specialist. These people can really help evaluate and manage the dysautonomia symptoms, and they might look at and talk to you more about hydration, electrolyte strategies, compression garments, exercises, medications when appropriate. But hopefully, as you're seeing, even with this, we're talking about exercise progression, compression, these physical things. So even with just the POTS symptoms, also get a PT on board for you as well, and a pelvic floor PT at that. So beyond that, especially for MCAS, we want to be looking more at like an immunologist or an allergist, because mast cell activation is more of that immune response. So we want to get an immunologist or an allergist on board so they can look at these other symptoms, especially things like flushing, you're getting really white or really red all of a sudden, hives, itching, food sensitivities, GI symptoms, allergic type reactions, right? This is really where we want to look at that MCAS system and what's happening. And this can help patients better understand your triggers and symptom management and all that stuff. But with that, also I think having like a rheumatologist or a genetic specialist can be helpful if you suspect like EDS or some hypermobility issues, or you are just having like systemic inflammation. They can help rule in or rule out, rheumatoid arthritis, other immunology issues, immune system issues, so that you can see the bigger piece and not just be like, oh yeah, I'm flexible, right? Like it might be bigger than that, because even some people with EDS, that extra connective tissue and loosey-goosey hypermobility can go as severe is causing cardiac issues. So this is why having some of those genetic testing done or having a rheumatologist on board can help you navigate that. And then as always, a pelvic floor physical therapist. This is obviously my favorite, and we do help address pelvic pain, prolapse symptoms, leaking, urgency, constipation, painful intimacy, pressure, heaviness, postpartum recovery, pregnancy, birth prep, movement, exercise modifications. I'm here for it all, friends. But a good pelvic floor PT isn't just looking at your pelvic floor either. They're looking at your breathing, your pressure management, your mobility, your strength, your nervous system regulation, your total body movement strategies. That's what I'm really passionate about. And we really want to make sure that, getting in that strength is something that you're doing safely, because with hypermobility, you are at more of a risk of hurting yourself. So there's a safe way to do this. And this is where coaching really comes into play. Therapy really comes into play. So reach out. Also, don't forget to use that $20 off discount with mentioning the podcast for our 200th episode. But beyond that, having a mental health professional can be a game changer, because obviously it can be very frustrating and exhausting living with these chronic symptoms. So if you are experiencing anxiety, grief even, frustration, medical trauma, isolation, mental health support isn't just because symptoms are all in your head. It's really just to help you cope with all of these symptoms, because chronic illness is hard. I'm really starting to learn that myself. Beyond that too, I think even having a registered dietitian can be amazing, especially someone familiar with these syndromes, right? MCAS, POTS, GI dysfunction, chronic illness, because nutrition can impact your hydration, your inflammation, your symptom management, your energy levels, how you recover. So just what we eat can really fuel or harm and cause flares with these symptoms. And a dietitian can really help you navigate nutrition without unnecessary restriction or fear or anything like that. And as far as the PeVD goes, guys, this is where you need a vascular specialist, and I especially encourage an interventional radiologist. So interventional radiology is the high standard of care. Some people start with vascular surgeons, but interventional radiology is where you really want to start out. And especially if you are experiencing those symptoms of pelvic heaviness, pelvic aching, ovarian site pain, hemorrhoids, vulvar varicosities, like maybe you're even seeing those veins and varicosities start to come out externally in the vulva and in the groin area. And maybe you are getting those worsening symptoms with prolonged standing standing, prolonged exercise, prolonged sitting, intercourse. This is where a vascular specialist or interventional radiologist may be really helpful in evaluating pelvic venous disorders and just discussing your treatment options. And then, yes, any type of nervous system support practitioner, whether it's going to a mental health therapy, mindfulness coaching, breathwork specialist, yoga, somatic practitioner, sound therapy. There's lots of things here, guys. And so it's not just one person. And I want you to really just remember, you do not need every provider on this list. And you certainly don't need to find them all at once. Start with the symptoms that are impacting your life the most, build your team gradually, ask questions, advocate for yourself, and remember, you're not a collection of disconnected symptoms. You're a whole person, and the best care often happens when providers work together to see the bigger picture. So many women are dismissed and misdiagnosed and told their symptoms are just anxiety or in their heads, and this can be so freaking frustrating. So just know, your symptoms may not be random. Sometimes they're clues pointing towards a bigger picture, and I'm here to help you navigate that, friends. So if this resonated with you at all, please, again, reach out. I'm here for you. Let's get you on some coaching. Let's get you on some one-on-one therapy. Let's just get some help, get you started. Reach out. My email's in the show notes below. And also find me on Instagram over there at The Balanced Momtality, because I do also talk about this in that space. You feel free to send me a DM. I'm a one-woman show, guys, so it is me responding. If you have any questions, I'm here for it. I hope this brought some aha moments for you, because I know I had so many aha moments doing this research myself, and I'm still on my journey myself. So there will definitely be more episodes about this kind of condition and issues. If you have anything specifically you want me to address and look into, again, reach out. This show is here for you, and I'm here to support you. So let me know, but I'm here for you one way or another, and I hope you enjoy the rest of your day, and I can't wait to see you here next time on the show.
Well, that's it for today's episode. I hope you enjoyed it as much as I did, and I want to thank you so much for taking the time out of your busy day. I know you've got so many other important things going on, but I hope it was helpful and you leave here with some tools to help you in your healing journey. And I just want to ask you, if you have found this helpful, to please leave a review on iTunes. Scroll down to the bottom of my podcast page and leave that 5-star review so it can help other women see this information. And also, if you want to be a part of my community of amazing women trying to balance all the things, great tips and insight and sharing stories and just motivating each other along the way, feel free to join my Facebook group, The Balanced Momtality, Wellness and Support. I hope to see you here next time on the Balanced Momtality podcast.